still question myself from like the mom perspective. Had I been more aggressive, would it make a difference? And I'll always question that too. Like if he relapses, could have finding it when it was smaller have made any difference? Like, yes, we achieved a gross total resection, but we know with ependymomas, which is the type of brain cancer that he had, that they often recurrently come back, and they come back and come back until you run out of options. And so just like really hard for me to say. Sometimes I get that sentence out without crying. Other times I break down. But, I think I'll always question as a mom, could I have pushed harder, and what can we do to raise awareness of these darn diseases so they're more recognizable, and maybe we can intervene sooner. Maybe it would have an impact on long-term survival and outcomes.
Yeah, early detection is something that is huge, and it's huge in adults, right? We always push for early detection of some of the bigger cancers that affect adults, but for kids, you're not really looking for that. You're looking for what's the easiest. And I always say treat them and treat them, and I'm not saying it in a mean way, but it's like you're not looking for, if they come in like with our daughter with constipation or something like that, you're not looking for, okay, that could be brain cancer. But at the end of it, once all of that is through, and my wife, and I will tell you that she felt like she was crazy because she was in ERs, in the urgent cares multiple times, to the point where she thought they were physically watching her, that she was there for attention. And finally, for us to get it figured out, and when her eye turned in, okay, they said swelling of the optic nerve. As soon as that was a thing, she was on the internet looking it up, thinking it's the worst thing, and the first thing that pops up is possible brain tumor. And I said, no, that's not what it is. That's not what it is. We're not going to do that. But as soon as that was the diagnosis for that, like I said, we got a phone call from our pediatrician. She said, you're going to Milwaukee right now. And at this point, it was 6:00 at night, on our oldest daughter's birthday. We're trying to eat birthday cake, and we're like, we got to go. We got to go. We got to go. We got out there. But within a 10-minute, not even, within a 30-second CT scan, she has a mass in her brain. We're admitting you now. And when we got the diagnosis, it was choroid plexus carcinoma. It was very rare in a sense of there's no protocols for it. Most people don't even know what it is, haven't heard of it. And the oncologist at that time said, and there's not a very good prognosis for this. First thing we're doing, we're on the internet searching. We're trying to figure this out. And again, we're asking the same exact questions. Those what ifs will drive you insane. What if we had caught it sooner? What if the pediatrician would have pushed for those? But are they looking for that type of diagnosis? And no, and it's not a knock on the pediatricians, but they're not looking for those types of diagnoses. They're looking for what's the easiest way to make them feel better and try to figure this out without going that far. But I've had an idea for a while, and maybe people agree with me, maybe they don't. But when it comes to early detection, I really think that a child has a yearly exam. They go in, they have their shots or updates. I think that either a CT or an MRI should be available. You don't have to use it. It's there. It's covered by insurance. Okay, every year, whatever. I think it should be an available thing that you don't have to push for, but it's there if you want to use it. And who knows if we would have caught our daughter's tumor sooner, would it have made a difference? There's no way to tell if it would have made any kind of difference. I didn't even know what a blood-brain barrier was until we went to high-dose chemo. And I thought this whole time she was going through her chemo treatments that we were treating her cancer, and it wasn't making it past where it needed to go. Because up until then, there were no detection of any cancer cells in her CNS fluid ever. She never developed a tumor on her spine, which is very common with that type of cancer. It never spread anywhere after that tumor she had a total resection. She had directed radiation on that area. It never grew back, never had any issues. And then at one point, a small lump developed on her brainstem. You cannot operate on that. We're going to go in, we're going to start your high dose chemo then. And that was probably, or even start her chemo, I apologize. She went through 30 rounds of radiation, and then they decided we're not going to do chemo because she's NED. She's showing no signs. The radiation's done its job, and we're not going to do it. My wife and I still go back and forth to this day. If we would have done chemo right in the beginning, would it have made a difference? My answer, I have no idea, but I look at the 7 months that she had happy and running around and healthy before that relapse that she would not have had if she would have gone through chemo, because when she went through chemo, it just, it rocked her. And it's, to be a small child going through this, I don't think I could take away that 7 months that she had, even though what she went through was so rough. And the things that, like I said, the things that I've seen, the things that I could tell people and show people, the stories, the images, I've always said they will bring the strongest man to his knees, 100%. But the people that we need to bring to their knees are the ones that are writing the bills and the laws and handling the money to make sure that it's going towards early detection, that it's going towards treatments that are not so bad that they have names like the Red Devil, like these drugs that are nicknamed. And it's because of what they do to you and what they do to the inside of you, or to be told as a parent, don't get this on you. Don't get this chemo drug on you. Don't get this drug on you that excretes through their pores, because it can burn you. And to me, for the same reason, I didn't care about putting, I did it anyway, but it's just sitting there with an x-ray and, put on the metal vest. I didn't care. All I cared about was her. What you're doing to her, I don't care what's happening to me. And then you're going through these treatments, and I'm supposed to be careful about being close to you and being your father. I didn't care. But thinking about that, what it's doing to the inside of their body, and worrying about, and that's something that people really need to understand. They think, well, they've got kids drugs, that they treat them with kids drugs. No, it is, and I've said it, it's the same drugs in smaller bottles, but you're thinking about it like that. You have to understand it. But we're not going, but we get smaller drugs and kids drugs if you go down to get, Pedialyte, or you want to get children's Tylenol or something like that. They make it specifically for kids and different types of doses and things, not chemo. There's only a couple. I think there's 6 drugs in total that are meant to treat kids, but it's I really wish that we could share more of the images without social media really kind of covering them up and censoring them. Because yes, it's harsh, and yes, it's terrible to look at, but it's a reality. It's a reality we live with every single day.
Yeah, I think there's always that challenge of sharing their reality and then people looking away. But I think without sharing their reality, people don't realize the need for change. The hardest part of next to delivering the heartbreaking diagnosis of pediatric cancer, is then me having to sit down and discuss with the parents the side effects of the treatments. And it's scary enough to hear that your child has cancer, because cancer is a scary word, and we know people can die from cancer, and it's, your own body's cells have betrayed you and are, growing out of control and not obeying the typical rules of when they should grow and when they shouldn't. And knowing that, and then having to sit down and hear that the treatments that we have can cause life-threatening side effects themselves. I think that is, like, not only do I dread each time having to give this terrible news and knowing that I'm turning someone else's world upside down, because I have been also on the other side of the bed with that, but then having to talk through the treatments. As I tell my patients' parents, I will always be honest with you. This is your child. Like, you deserve to know everything. And so whenever I know something, you'll know something. And when it comes to treatment, I'm going to be honest about the side effects too. And I really wish we had better treatments that only targeted the cancer cells and didn't have such effects on neighboring cells. Yes, chemotherapy has more of an effect on fastest growing cells, because they're in the middle of the cell cycle, and that's how those cells, that's how the chemotherapies work. They interrupt something in the cell cycle. And so yes, the fastest growing cells will take the largest hit, but there are other fast growing cells in the body that are healthy, like the lining of your mouth all the way down to your bottom, your hair. And so with that, mouth sores and the lining can become injured enough to the point that it's life-threatening. That's what happened with my son, which was unexpected with the chemos that he had, frankly. So I don't know why he metabolized the chemotherapy differently, but he developed what's called grade 4 mucositis. And that is where the lining from his mouth all the way down to his bottom and his respiratory tract all just died and sloughed off. Like we were seeing dead gray tissue come out of his bottom in like watery, current jelly diarrhea. And when they intubated him when he had septic shock, which is a bloodstream infection, and then, you're not getting appropriate blood flow to all of your organs and things start to fail. When they intubated him, they later told me that his airway looked friable, which is like the worst description to ever hear of what your child's airway looks like, and scary. And I like had thought to myself, like, oh my goodness, like if his airway looked friable, and just seeing all of the tissue that was coming out of his bottom from the toxic effects of chemotherapy, I'm like, how is he going to heal from this? And like, how will this affect him long term? And we know that the treatments cause long term side effects. I mean, I know myself, I had radiation, I have radiation induced blood vessel tumors that are, quote, benign because they're not cancerous. They don't grow and like invade, but they grow and they bleed and they cause damage that way. And I'm also at risk of developing malignant brain tumors because of radiation. And we know radiation can cause malignant tumors later on. We know chemotherapy can also cause secondary leukemias later on. And it's so hard to have these conversations to, tell parents and children that they have cancer, and then that there are these other side effects that can happen in the short term and in the long term. And so I always have to frame it as, we have to fight the first evil, because we know if we don't fight this first evil, like we don't even have, a subsequent time. And, so we'll deal with those long-term side effects if they should come later. And we know what to look for with, the chemotherapies we've used for decades and that we've studied, and we've subsequently over time have learned more and more about these side effects. And there's probably even more that we've not yet learned, and there's still to discover about these chemotherapies. But I just wish we could fund the research. Everybody's trying. I will say there are a lot of people trying. We just need more people on board. These cancers are not easy. I mean, if they were easy, then we would, obviously have cures. But trying to figure out like how can we better target these cancers? What proteins are maybe present just on these cancer cells that we can target with some sort of immunotherapy, to where it's more targeted and not systemically damaging. I know that's been a challenge with various cancers because we've not been able to find unique proteins in all of them. And so there are healthy cells that have those proteins too. And obviously that's the challenge. Like, for example, many people have tried finding what's called CAR T cells for AML, but it's been a challenge because the proteins on the surface of the AML leukemia cells are very commonly on the surface of healthy cells, and so end up not being very effective in being targeted in that realm, and also have other side effects that aren't intended. So there are many people trying. I just want there to be more funding so we can get more people on board, maybe understand what causes these cancers in the first place. So maybe we can, have some preventative measures on board. And then additionally, how can we get rid of these first evil cancers in a more targeted way so we have more effective treatments and less long-term side effects as well. So that's an ongoing challenge, and I hope to live long enough to see us make more progress. We have made some progress in targeted therapies and targeted medications and finding medications that affect, some mutations that we've discovered. But in the more rare cancers, like my son's, for example, and it sounds like, choroid plexus carcinoma, in which there are less than 300 cases a year. I get that it's hard because you have fewer cases to test and to kind of see what will work. But if we can find a way to collaborate even worldwide, so then we have more numbers of these cases together to have the data to figure out what works best and how can we target these and what drives these cancers. That is my dream that I hope to live long enough to see, is us figuring out, one, how to prevent these cancers, and two, like how to treat them more effectively so we have more survivors and survivors living with more quality of life.
Yeah, when you think, I think so. For reference, if anybody's ever had surgery or anything like that, and you're going to get a sheet from the doctor that's going to tell you what it is, and then there'll be a list of what the possible side effects are of that surgery. For chemo, the first page tells you about it, and then there's about 5 pages on the back side of it are all the side effects that could happen. And these are just potential side effects from the chemo that they're going to be receiving and that type of stuff. But what I will tell you, the long-term side effects that come from this, and I've often said are often worse than the actual cancer themselves. That mucositis, when our daughter had that, was the worst. And to see her go through that, develop C. diff in the hospital, it's very, very scary to see this happening. You look at, everybody just sees, oh, well, their hair falls out. There's so much more. The hair falling out is probably the least of all the worries when it comes to side effects. Hearing loss and cognitive delays and loss of fertility, growth, you stop growing. I mean, there's so many things that can happen, and then they deal with it long term. And I was reminded of a story that I was looking into when I was trying to work through legislation a couple of years ago, of a girl that had finished her treatment, got the binder, but inside the binder was a list of 12 different types of cancer she was susceptible to because of the treatment. You go in thinking, I'm done, I'm out of here, I've made it through this. Now I got to worry about all of this because of this. It's a horrible thing to think about, and a horrible thing that you fought so hard and went through all of this just to realize that it could all come back again in a totally different way. And that's where we need to figure this out. There are companies, our organization, we hold an event every year. We just donated $25,000 to research to help fund a clinical trial for a new drug that is going to work towards 5 different types of cancer. And I'm so excited about that because we see, our efforts moving forward into something that could be positive. And we chose this organization because they only focus on pediatric drugs. That's all they do. And that's what we need. We need more of that. We need the pharmaceutical companies to not worry about how much money it costs to fund a pediatric trial. Just do it. We need the FDA to understand how fast these drugs need to be approved if they're showing promise. We need clinical trials to be more, presented to us versus us searching as parents and trying to find them and find the right place for them. There's a lot that goes into this. And we've just returned from DC. There are a lot of advancements. Things are happening and things are moving. I was able to tour a lab at UW Wisconsin. They're doing amazing research for neuroblastoma, and I see the work happening. But to us on the, if you're not in the lab, if you're not there doing it, or to parents on the outside, it's a snail's pace. And it didn't move fast enough for us, and it's not moving fast enough for everybody else. And, awareness is a huge thing, and just getting people to listen is very, very tough. But the reality of the way the treatments happen, the side effects, the images, the long-term wondering, you're living on the edge every single day. That scanxiety is a real, real thing. It is scary. You're 3 months out, first month, you're living your life. The second month, you're getting a little weary. Third month, you are on the edge of your seat every single day, hoping that those tests come back and everything is clear. And, and from a parent going through this, a cough is never a cough anymore. A bruise is never a bruise anymore.
Yes. PTSD.
Yeah. And it's like we associate PTSD with military or first responders, but as parents going through this, you are stressed out by this type of stuff and smells and sounds and getting close to those diagnosis anniversaries, if you want to call them, and that kind of stuff. And getting, they're looking for 5 years. 5 years is the national number for cancer free. And you're hoping to get to that 5-year mark, and you're hoping to be part of that. I think 80% cure rate is what they claim now. You're hoping to be part of that. But
Well, and it depends on the type of cancer. Some even get to 5 years and you're not considered cured. Like ALL, if you get to 4 years in remission off of chemotherapy, you're considered cured. We have data to show that. But other cancers that commonly recur, like sarcomas, for example, they continue to commonly recur. Ependymomas. I had to sit through a board review course for my American Board of Pediatrics pediatric chemo board exam, and to listen to the lecturer say ependymomas tend to chronically recur, and it's one of the brain tumors for which the survival continues to decrease with time. It was so hard to sit through that and listen to that, because the cure for pediatric cancer, I understand why we have to start at like a short interval to see that we're making progress. But to think about like a goal of 5 year survival, we want kids to survive longer than 5 years. Like they have an entire lifetime, or they should have an entire lifetime ahead of them. And so, thinking about, short term, like, yes, like we want more time in the short term, but also in the long term. So what can we do to achieve that? What else should we be doing? What people do we need to get on board? The funding, and I know it's a challenge with pharmaceutical companies and them wanting to get a large return on their investment, right? And so they get a larger return on their investment because adult cancers are in greater number. But, we should still make it a priority for children who are our future to find cures for them too. And, how can we get them to see the value in that, so I don't have perfect answers for that, but I think about that as a parent. And then also as a survivor, going back to the binder of possible long-term side effects, I too received a binder full of possible long-term side effects when I finished treatment, and I read through it and I acknowledged it. And I said, well, I'm not going to worry about something that may not happen. So I'm going to put it under the bed and be aware. But even my radiation induced cavernous angiomas, the leaky blood vessel tumors in my brain, were not listed in my binder. And so we're finding more and more long-term side effects that we didn't realize were problems. And so, what can we do to increase awareness that this is a problem? And it's not just a problem in the short term in childhood, but it's a problem, getting more kids, to survive and to survive with a quality of life. I mean, the numbers of kids included in the statistics of dying from cancer often, I feel like, aren't reflected in kids dying from, for example, infections during their treatment. The chemotherapies that we give increase their likelihood of dying from a life-threatening infection. Thankfully, most don't. Most get fevers, and if they have a bloodstream infection, thankfully most clear that infection and live, but some of them don't. And it's even tougher when that happens, because it's like, here you are trying to cure their terrible cancer, and in the process they die of something else that was a consequence of the systemically toxic treatment we have to give to try to get rid of their darn traitor body cells that are growing out of control. And so it even just adds to the heartbreak of pediatric cancer. Not only do you have this terrible thing that's growing inside your body or your child's body, but then we have to give these highly toxic therapies, try to get rid of these traitor body cells that are the devil inside. But also those therapies can end up making you more susceptible to life-threatening consequences. And and so we need to find something better. And I know there are a lot of people who've dedicated their lives to this and are really trying. We just need more. We just need more funding, more people passionate, looking into these things from a treatment standpoint and from a preventative standpoint, understanding what drives these cancers. Why do they happen? Is it something in the environment? Is it, something in our diet? Is it something that we're exposed to within our water systems? Like what is it? And so we need more research all around to really make a difference for our kids, who are our treasures. Again, going back to September being Childhood Cancer Awareness Month, gold being the color, because children are our treasures. So we really need to attack pediatric cancer from many different fronts and get people involved.
Yeah, 100% we do. It's gotta come from everywhere, and everybody's got to be on board with trying to fix this problem. And it's a big problem, and the ultimate pandemic, if you will. It needs to change, and it's something that the side effects, like, I think you could almost talk about them all day long, about the effect that they have mentally and physically on the children, and how sometimes the side effects are what ultimately are their fate. And our daughter developed leptomeningeal disease, and it was played down for us. by our doctors and played down to a way that we weren't we weren't smart enough to understand or couldn't understand the big words because we're not in the medical field. But let me just tell you, just on the outside, as parents, I promise you that we know what these big words are. I promise you that we understand what they mean. And that was the worst to watch that. And I think about it, when I was a kid, my mother had to have open heart surgery and she had ventricular tachycardia. And I remember when she had it, she was on probably a dozen medications. And I couldn't understand, like, if they fixed the problem, why are you on so many medications now? And it was the same thing for our daughter. You get out, you get through chemo. Well, now you're going to have kidney issues. So now you're on kidney medication. You're at the risk of seizures. So you're on anti-seizure meds and your lungs and all of this. So you're on 12 medications when you come home from what was supposed to make you better. And it's a life that changes 100%, moving forward. And that's something that we need to fix. If we're going to fix the problem and we're going to make them better and we're going to give you a life and allow you to live that life in a quality way, then it shouldn't be you have to take pills for the rest of your life to fix what the medicine did to you. Like I said, there are some good advancements that there's really good studies on natural killer cells. And I hope that just explodes and takes charge of things and gives people the options. And again, all of these trials, a lot of them are out of the country because it's easier to get those drugs into clinical trials and to get tested and things like that before becoming here. And, that's just the way it is. But I'm hoping that those things, get better and we start to get more options and changes. But yeah, the side effects and what you deal with afterwards is so much worse. And we have to find a better way to get there without having so many bad things.
I mean, I will say I am grateful to be alive. I would say overall I have a pretty good quality of life, but it hasn't been without additional tragedies from, side effects. And, I just want to be a part of making that better. I don't think I shared that. In addition to being a pediatric hematologist oncologist, I'm one of the survivorship doctors at our hospital. And so I'm very passionate about, teaching the patients and their families about what to look out for and also how to advocate for yourself, especially when you're in a community that might not be as familiar with the side effects of treatment. As a lot of primary care physicians don't know about the long-term side effects of treatment. And so they might mistakenly think, oh, you're too young to have that problem. Like you're too young to have a heart attack, or you're too young to, experience dementia, or you're too young to have XYZ. And so, I mean, even with my diagnosis with my radiation-induced cavernous angiomas and my brain bleeds, the family physician who saw me at my med school, I think he thought I was crazy with my symptoms. And, he did the blood work and nothing came back with any inflammation. And he tried telling me like, oh, maybe it's just some weird virus. And I thought to myself, he realized like he was talking to you like, hello, I'm a medical student. The white blood cell count is not elevated. I don't even have any monos or lymphocytes elevated. Like, why does he think this is a virus? And, even when I had my first brain bleed recognized by the neurologist, and she said there was only a 15% chance it would bleed again. And I called her from clinic with the same symptoms. And she had said, are you sure? Like, what makes you think it's blood again? And I said, well, I'm having the same symptoms. And so even the disbelief with that. And I think, just many people don't recognize the long-term side effects. And I hear over and over again from survivors. I actually run an online survivor group called Childhood Cancer Survivors United. I had started it after I had my brain bleeds and had to take time off for brain rehab. And again, when I was, like I said, when I was feeling alone, and I found my friend Rachel, and over and over again in that group, survivors talk about how they have symptoms and they're oftentimes not believed by their primary care physicians, and they continue to go back and go back. And then finally they find it out that they have a long-term side effect, and a long-term side effect is diagnosed. And, I make it my job when I see survivors in clinic to let them know what we do know, and let them know, these could be potential signs of X, Y, and Z. And this would mean that you need to get checked out. And here is your treatment summary. Wherever you move, you should have your treatment summary with you. So then you can share with your physicians what drugs you received. And they can look up on Children's Oncology Group the long-term survivorship guidelines, which are actually public for anyone to look up. And so then they can correlate with your treatment summary what you're at risk and screen you appropriately, because not all communities have pediatric cancer survivorship clinics. And so you might move to an area that doesn't have one. And so you need to be able to find a primary care physician who you trust and that you are able to provide your treatment summary and you know your own medical history and point them to like, no, actually I am at risk for this. Like I know I seem young to, have this problem, but I am at risk for this problem because of the treatment that I received. And so I make that part of my job and my counseling for my pediatric cancer survivors. And especially as they are older and they're going off to college, because even myself, when I, away from where I initially was treated, I had my medical records myself. And I made sure when I moved out of state that I set myself up with each specialist that I needed, a cardiologist to monitor for, heart problems because I received the Red Devil chemotherapy, the anthracyclines. I set myself up with a neurologist because I had the radiation-induced cavernous angiomas, so I get yearly brain scans. I set myself up with a neurosurgeon just so they were familiar with me and my scans. So if I should have one of these that grows in the future and bleeds and I need surgery again, that I'm connected with someone. So it is a greater healthcare burden than, like I said, my peers, which again, it kind of dispels the idea that once you're done with the primary fight that you're done. And it is an ongoing mental health burden too. Again, feeling different from your age matched peers. And like most people my age, in their 30s, don't have all of these physicians that they have to see and all the screening that they need. A lot of my peers don't even have a primary care physician because they're healthy and they think that they don't need one, and so it does make me different. But I will say I am thankful, for the life I have been able to live, because I know not everybody gets that. If I would have died at 11 and here I am 37, going to be 38, there have been so many things that I would have missed out on and for which I'm grateful to have. And I also want that for all kids. Like yes, like it's not been an easy road. And there are side effects from treatment, but there's still gratitude and joy for what I've been able to experience. And that's another lesson that I've learned is you can continue to grieve. Like grief is continuous. Grief never ends. And it's valid to grieve. It's valid to grieve, the health that you once had, the health that your child once had, dreams you had for yourself or your child and how things have been altered. It's valid to grieve the side effects loss. Like my son is likely infertile from the chemotherapy that he had. He has hearing aids because he has hearing loss from the cisplatin chemotherapy, and kids his age view him as different because they're like, well, what's wrong with his ears? And when we were pregnant with my daughter, his younger sister, I felt joy that we were pregnant with her, but I also felt the grief that one day I'm going to have the discussion with him that he likely won't be able to have kids in the way that most people have. And we did a testicular cryopreservation surgery where they took a section of his testicle and have froze it in case that technology comes about that maybe they can use his tissue in the future, but that's not perfect yet and it's not been proven. It might not work. And, so grief doesn't cancel gratitude. Like they can go along with each other. And so I will have to at some point have that conversation, which I dread. But, I am thankful for every day, even with side effects. And I know a lot of pediatric cancer survivors feel the same. We just wish that we didn't have to deal with ongoing medical problems and worries that, nobody wants to be sick. And there are many different medical conditions. Cancer isn't the only one that causes suffering for people. But of course, we're all in this together and we want to make it better. I've lost pediatric cancer survivor friends. Like I had mentioned, my friend Rachel was the first one that I met online when I was looking to connect with a pediatric cancer survivor who had experienced long-term side effects and I was feeling alone. She passed away. And my friend Loretta passed away and my friend Stephanie passed away, and they passed away of cancers caused by the very treatment that they received. And so, yeah, that's awful. To survive like the first cancer and then later to develop cancer due to the very treatment that saved your life. Like, surely they're thankful for all the time that they had, but we want more. Like, we want a whole lifetime and would like to include, improve the quality. And we want that for all kids. We want more targeted treatments, more effective treatments. So survival is measured in more than 5 years. So survival is measured in decades. A human being, we feel like, should have decades. And maybe I'm, over speaking what my expectations are and what I feel like people should have. I recognize people used to die of illnesses in childhood, centuries ago. And, I'm grateful that we've made progress, but I just want more. I want more progress.
Yeah, I think that there's been progress, but at the same time, it's 2024, and I feel like we should be farther along in figuring out this issue. It's in painting it as getting better is what that does is it takes the awareness away. Because when we see the commercials or we see the government posting it's like they look at it like it's not an issue anymore. Okay, well it's under control. I don't need to donate. I don't need to pay attention to it. No, we really need to paint the pictures. I'll be honest with you. I wish that the things we saw on TV more portrayed the ASPCA commercials to really show the reality of pediatric cancer. And that's not a knock on the organizations that do that, but it's by painting it as happy kids and running around and smiling, you're not showing the reality of what pediatric cancer is. And yes, our children smile, and yes, our children have good hearts, but that's because they're innocent. That's because although they understand, they're still developing as a child. The reality of it is the late nights. The reality is changing having your children, clean their own port and flush their own and their catheters and stuff and doing it on their own because they've learned and they've watched their doctors do it. And being able to name chemo drugs aside from what they would learn in preschool, these types of things, that's the reality of what it is. They're not running around. When we were stuck in the hospital, the only thing that made my daughter happy besides us just kind of goofing around was making TikTok videos. It wasn't running around the halls and wanting to play with the nurses and things like that. No, it was she wanted to get out of there. She wanted to go home. And so it's the reality side that I wish people could see more of, and then we give them that quality of life and give them that, I think a child diagnosed or a child that passes loses 70 years of life. That's a long life that you're missing out on. That's your future doctors, nurses, pilots, politicians. That's your future right there. And without it, we don't have anything to really work towards because the future's gone. And I can understand the view on a politician's side. They cannot vote for you. However, if they don't grow up, they won't be voting for you either. And therefore, your job is not very secured. And the people that are creating these therapies and creating these drugs and these researches and these finds, these are the kids that are growing up and going through this. Listen, you're doing, you put your passion into something that can give back to all of these families and have a connection to them that not many people do. And when I hear, and I've interviewed a lot of people that they were going through it, they're going through medical school. Now their child was diagnosed, but now they're going through medical school to be a nurse or to something like that. You have a perspective that allows you to connect with these patients and these families on such a personal level. And when you're going through this, to have somebody that understands or listens to you and treats you like a person and tries to take that burden off of you as a parent, it is so monumental and so incredible because we're scared, but we're not supposed to show it in front of our kids, right? You're not supposed to cry in front of the patients. We're not supposed to, break down in front of our kids. And you really should kind of make time to do that and separate it and not do things to scare your children. But we're human and we're emotional and we're going through all of it, and we don't sleep and we don't eat and we don't take care of ourselves. And to be honest with you, if you're a parent listening, you have to make time for you. You have to make time to it's okay to walk away. It's okay to take a break. Your child, I promise you, they understand. Yes, they're scared when you leave and you're scared, but they understand. I mean, our daughter spent all the time apologizing to us, like she did something wrong. And we had to continually tell her, you didn't do any of this, but we're okay. Mom and dad are okay being here taking care of you. That's our job. You don't have to apologize. And there were so many things that just made it all, super scary, but also super easy to deal with when you have the right people on the right team wanting to be there and give you that support and show you that, yes, I am your doctor, your physician, I am your nurse, but I'm here as a person. I'm a parent too. And, when they, like, to be honest with you, when they give you their personal cell phone number and say, call if you need anything, let me know if you need something. That's, it's just, I wish I know there's a lot, and it's a very small majority, I think, that are very disconnected from their work. But the vast majority, aside from those two people, the vast majority are so connected that they're there for you and make it an experience that is not so scary in such an uncertain time.
I agree with all of what you say, having been on all sides.
Well, so actually I want to ask, so how is, and I know you have scans and you're into that section of getting into the 3 month to 6 month scans and they start going out like that. But how is he doing in general? Like, is he just smiling and acting like nothing happened? Does he give his siblings give you a hard time? Because that's what I'm assuming, because my kid did.
Yeah, looking at him, you wouldn't know what he's gone through except for his hearing aids. And you can kind of see the scar in his hairline if his hair is short enough. He has scans next on October 30th. So that will be the first 6 month scan. So you talked about scanxiety earlier and how that's a real thing. It is a real thing. The longer you go from the last scan, the more the anxiety is kind of built up. Is there going to be something that's lurking there that we don't have symptoms of yet that's going to be found? But he is in special needs preschool right now. It'll be his third year of special needs preschool. The previous state that we were in, early intervention ended when you turned 2, and his birthday's in August. So he had started special needs preschool when he was 2. But where we are now, you don't go into kindergarten unless you're 5 by July 30th. So he missed that timeline. But I'm actually grateful that he has another year in special needs preschool because he's still behind in language. He has progressed a lot in the past year. When we first moved here for my job, where I am now, he had a lot of jargon and you couldn't understand what he was saying. And it was really heartbreaking to hear from the teachers that he oftentimes interacted very little with his peers and then would, choose to walk away and play by himself. And I think a lot of that kind of being behind socially and language wise has impacted his development due to his hearing loss. I could tell he'd get frustrated when we didn't understand him. And we'd say, "Oh, I'm sorry, Thomas. Like, can you say it again? I don't understand." And so he would try to some extent, and then I think he would finally just give up and get frustrated and walk away. And I had a sense that is what was happening, even socially in school last fall. Because if he can't understand what you're saying, and then you can't understand him, what's the point? And so they've done a lot of great things in his classroom as far as the teacher using a microphone that goes directly to his hearing aid. So he has that direct input. They've situated him in the classroom to where he does lip reading, so he can lip read his peers better, and he's gotten better with that. They did testing that determined a lot of what he does to understand is lip reading, which of course was a challenge during COVID when we were all wearing masks, obviously for good reason, try to protect people, but it obviously doesn't help people who are hearing impaired. And he gets speech therapy in school, and a hearing resources teacher works with him too and helps teach him also to advocate for himself, like if the microphone's not working. And he gets occupational therapy in special needs preschool. And so he's actually made great progress in the past year. We understand a lot more of what he's saying, and he's putting more and more words together in sentences. Socially, the teachers have reported that he's doing much better, and he has friends and he interacts. There's still sometimes that he likes to, I guess, play on his own, but that's okay. Maybe he's just a little bit introverted. And from a physical standpoint, he runs around just like any other kid. He graduated from physical therapy within a year of being diagnosed. It's really been the language that's been the hardest due to the hearing loss caused by the chemotherapy. But he seems very happy. I don't know that he remembers all the trauma that we do as parents with seeing everything that he went through with his weight loss and his grade 4 mucositis and him almost dying due to septic shock. But he does know every time we go to the hospital that he's getting pictures. I've always tried to frame it to him like, okay, Thomas, like, now it's time, you're not gonna be able to eat anything after you go to sleep tonight. And it's because you gotta get sleepy medicine and pictures tomorrow because you had that sickness in your brain. You had brain cancer, and we, just want to make sure that it's still not there. And if it is there, that we do something about it. And I try not to shield him from the word cancer because that's the other thing that's come up in the survivorship group that I run. Some kids didn't know that they had cancer until they were an adult. And so they kind of felt like their parents kept something from them and they felt like they had a right to know. So I'm always like using those words. I don't know that he really understands what it means since he was so little when he was diagnosed and going through treatment. But he recognizes, I think, that he's a little bit different because he does know he wears hearing aids and most of his friends don't. I don't think he has any friends in school that have the hearing aids. The same with his daycare. He's the only kid in daycare that has hearing aids. So I think he recognizes that he's different, which I know is hard to feel as a child, feeling kind of different from your peers. But he seems to really enjoy life. And even with his hearing loss, he can hear quite a bit with his hearing aids and he loves music. You'll hear him sing Frozen, sing Encanto. And so, he seems like a really happy kid despite having challenges. Certainly he gets frustrated still at times when we don't understand what he wants. And I think he still is struggling with words and language, but it's getting better. Like I said, he's in social needs preschool for which he gets therapies. Then he also gets speech therapy outside of school. And so he gets speech therapy every week. It was increased just a few months ago because they did testing, neuropsych testing, and showed that he's still quite behind in his receptive language. He's about average with expressive language and coming up with words that he wants to use to express himself and to describe his settings, but really understanding questions that he's asked. We're still working on getting those connections made, but getting better.
Good. I'm glad to hear it. And I'm glad that essentially he's not letting things slow him down, just continuing to move forward, even with everything that he's been then thrown at him. He's not allowing it to slow him down. And I like with JC, we were always super open with everything that was going on, with what was happening. And a lot of parents, again, I don't know that they don't say everything the way it is, but they, for lack of a better way to put it, they dumb it down a little bit. And I know we were just always super open with everything. And I just think it's important because, like I said before, I think they deserve the respect of being treated as an adult of what they're going through, and being able to be open with them with as much as they can understand, I think is super important, so they can really be in control of their care moving forward. They can be in control of as much as they can. And that's, when you, like, just with hair loss, I know with our daughter, there were about 7 hairs that didn't fall out, and she would not let us shave them or cut them, nothing. That was her owning and being in control and allowing them to be in control. And she lost hearing in one ear. She would have carboplatin, I think, did it, but she lost hearing in one ear. The one ear that didn't work very well, she would face that one up and lay on her good ear when she didn't want to hear us. And she would roll over, and that's when you knew she was like, I'm tuning you out. I'm done. I can't hear what you're saying. And it's funny because they take these, these things that have been thrown at them, or some of these side effects that aren't as bad, and they just kind of use them and own it and run with it. And I think that's that genuine innocence that I wish we had more of, because they're owning what's going through it. Us as parents and as adults, I joke about this all the time. The man flu is a real thing. That puts us out. We're done for. We're complaining. And these kids go through this harsh stuff, and they find a way to just smile and make you laugh and make you, less or more at ease with what's going on while they're going through the worst time ever. And that's I think what I miss the most about JC is that incredible spirit that she had to always make sure that we were okay, always make sure we weren't going to be scared and worried. And she told, I tell the story, and I try to get through it all the time, but on the evening that she passed, she woke up and was having trouble breathing, and we had oxygen for her. And at that moment, this was the second time it happened. At that moment, I looked at my wife. I said, "You need to go get our daughters. I'm pretty sure I know what's coming, what's happening." And I looked at JC and I asked her, I said, "Are you okay?" She looked at me and she shook her head, yes. And from that moment on, she went into that sleep that we're all very scared about. But she knew what was happening, and she was trying to make sure that I was okay, that we were okay. Their hearts and their innocence, what they have, that is what we miss in the world. And that's what I miss so much. And that's what so many people do not get to experience every day anymore, because we're losing so many children to this disease. 1,800 children a year are going to pass. That's the number, 1 in 5. And when you say 1 in 5, to me, and from what we hear from the non-movement of our government, is that means that one child out of every 5 is acceptable loss to them. And that's not okay with me, because right now I sit here without my daughter. There's so many, just 1,800 families sit there without their children. And if you ever have the opportunity, anybody, to attend CureFest, and you see them put 1,800 pairs of shoes on the lawn outside the monument, and these are shoes from tiny to teenagers that will never take another step, that will never experience love and loss, and will never experience college or doing things stupid like we did as adults, and kids will never have that opportunity. And none of these kids did anything that caused what they went through. None of them did. Some things within adults, you can have a link and a factor that will cause types of cancers to happen. Not all of them, but some of them can be caused that way. Like I mentioned before, having liver cancer and at 8 years old, I'm assuming you're not hitting the bars every weekend. These things just happen. And so there's so much more understanding that I wish would come through, so much more awareness to just the reality of what we're going through, not that they're kids. And please don't ever say, well, they're kids, they'll just bounce back. They're kids, they're strong, they're tough. Yeah, they are. But they're also tiny, and they're developing still, and their bodies don't have, obviously, if this is happening, they don't have what they need, the systems to fight this off. And we need to find a better way to give them the opportunities that they deserve.
Yep, absolutely.
Well, this has been incredible, honestly. And like I said, I've spoken to others that are going into the nursing field or into the medical field in some way. My daughter, my 16-year-old daughter, is going to be a child life specialist because of all this.
Great.
And it makes me so incredibly proud. So incredibly proud, because you lost your sister, you lost one of your best friends, and to be able to give back, it's incredible. I almost made it the whole time without breaking down, but
I know.
To see that is incredible, and what you're doing is incredible, and taking that role and that route in life to be able to be there for people in a way that people were there for you and have that connection. It's an honor to have been able to meet you and have you on the show today. So thank you so much.
Thank you so much. It was an honor to be on your show. Thank you for sharing your story of JC. Sorry we didn't have the cure for her, but I really hope for the future that we can get more people enthused about research and making it better for these kids, because kids deserve it. Like you said, kids don't do anything to get these cancers. And I know a lot of people, even adults don't, but there are some lifestyle habits that can, for some adult cancers, but kids really, they're innocent, like you said. And, what can we do to give them more of their life back that they should have, and with quality. So I hope people listen to this and that they're inspired to do something. I know we're all in this hard, crazy, wonderful life together, and we're moved by suffering, and it's a natural human response to, if you've been through suffering, to want to help other people. And I hope people really feel, what we've endured as human beings and what our children have gone through, and be inspired to do something to make a difference for these kids and the number one disease killers of our children.
I hope so. It's definitely something that I'm hoping more and more people will just come around and realize what we're doing here is we're not screaming and yelling because we've got nothing else to do. We're doing it because there's far too many children that are not going to get to go to school next year, and that are not going to get to grow up and make mistakes and decisions on their own, and they didn't have a choice in all of this. So we need to find something, and we need to do it. And this social media, this podcast, and just using your voices is the best way that we can continue to reach people. And so I'm not going to stop doing it. I'm not going to stop moving forward and fighting for this. And we couldn't save JC, but we are going to make sure that her legacy lives on, and that she continues to live and touch and inspire people. And that was what she left us. That was the mission, and we will make sure that it happens.
Awesome. Thank you for all the work that you do.
Absolutely. So once again, I want to thank you so much for taking the time and talking with me today and sharing your story, which is incredibly inspiring. And I look forward to Thomas taking over the world and seeing all of that, which is incredible. And everything that you do for your patients, you're an incredible asset to this community. And I want to thank you once again from our family and from all the families that follow us, that what you're doing is incredible. And thank you so much.
Thank you. It's definitely more than a job for me. It's my life mission. As I tell my patients and families, this is not just a job for me. This is my life mission. This is what I feel like I'm supposed to do. And so all of me is in it. I take it very seriously, and I treat patients and families as if I'd want someone to care for my child. And for me, and people like me when I was going through it. So like I said, I've had inspirations in my life, and Heather, my nurse, is one of them. My doctor was really great, and inspiring my interest too. And so I'm just thankful for all those who have been a part of my life and have allowed me to do this work. And I hope that I have many more years to do this work, and that I live long enough to see us make really great changes in the care for kids with cancer.
Absolutely. 100% agreed. I think we're on the verge of things happening. It's just a matter of getting that last final push. And as long as we continue to fight and not stop talking about it, then I think we'll get there.
Yes.
So once again, I want to thank you, and everybody, we will see you all next week.